welcome to a special show on the NDTV Detol Banega Swasth India campaign. Last week, we showed you the consequences of climate change, primarily mediated through global warming and its impact on human health, underscoring the urgent need for global action. But today, we are exploring solutions to mitigate climate change, which is not just the need of the hour, but also crucial for us and our future generations.
Let's begin with smart agriculture solutions. Agriculture and food production contribute significantly to greenhouse gas emissions through processes such as deforestation, livestock farming, and food transportation, highlighting the need for sustainable practices to mitigate environmental impact. How can we enhance agricultural resilience and the adaptive capacity of farmers in response to harsh weather conditions?
So what we need is a climate smart and climate resilient health system and a climate smart and climate resilient food and agriculture system. Similarly, we need in terms of the food and agriculture system, we need much more climate resilient and climate smart crops, which both can withstand the heat, at the same time have greater production for lesser investment of water, land and energy. Like for example, millets are very good. So we have to go in for things like millets and sorghum, for example. I mean, we will of course take time to reduce our dependence on other crops like wheat and maize, but we ought to plan our agriculture so that we actually move to crops which are much more climate smart and climate resilient as well. Chickpeas, for example, are much more climate resilient and they're a very good source of protein.
Science and technology now today offer us a number of solutions which we should leverage. For example, we now understand in plants, for example, that there are genes that we know make certain plants drought resistant or even salt tolerant. So giving the increasing salinity in our coastal areas and giving that more and more parts of land are coming under drought-like conditions. Other thing, for example, is rice cultivation. The way that rice is traditionally cultivated, it is responsible for a large amount of greenhouse gas emissions, particularly methane. We know now that technologies like direct seeding of rice or alternate wetting and drying, for example, can actually significantly reduce the methane emission due to paddy cultivation. So agriculture is a contributor also to greenhouse gas emissions. It's also impacted by global warming. So we can look at it from both ways. So I think we need a massive program where farmers get access to the latest knowledge, the latest information, the latest tools, which are actually relevant for their area. So it depends whether they are cultivating in an arid area, in a rain-fed area, in a saline coastal area. Depending on that, we need to. So I think the first thing I would say is that whatever knowledge today we have, we need to be able to disseminate that to the farmers so that they take action at the appropriate time.
Another solution with significant potential to de-risk the agriculture sector and attract financing the climate adaptation is insurance and risk finance instruments.
The Prime Minister's Fasal Bima Yojana, the big crop insurance programs, already quite a success. However, we can actually scale up the potential impact of their scheme by 3 potential interventions. The first one is on looking at technology. So a lot of the climate impacts are very local in nature. So if we can use digital technology, satellite data, information from weather stations, you can develop very granular, in some cases farm level vulnerability indices, and also that allows you to see what kind of response mechanisms are most appropriate. So first, we need to use technology. The second one is to start thinking about how do we use better financial mechanisms. So the PMFBY is already quite popular. It's already subsidizing the insurance uptake. But what are other opportunities to scale it up further? The third one is, how does one use technology to inform local level planning processes so that you don't really need to rely as much on coping mechanisms. And this is something that we are doing in pockets already, but I think that's something which should be scaled up going forward.
From smart agriculture, let's look at the mitigation and adaptation of healthcare centers. Simple yet effective solutions like solarization and decarbonization can bring down and reduce carbon emissions and also promote sustainability. This will bring an impact across the various aspects of healthcare delivery.
The global healthcare supply chain responsible for producing and distributing pharmaceuticals and medical devices comprises over 70% of the health sector's climate footprint. Health systems contribute significantly to global warming, accounting for up to 5% of global greenhouse gas emissions.
So as you understand, hospitals in providing healthcare use a lot of energy, which is in the form of four prime things. One is around the entire lighting and illumination that happens. The second is in terms of the infrastructure that a hospital has. There's a lot of energy that is taken into the building materials and all of that. The third is that in order to generate the airflow, which is through the air conditioners, the various kinds of coolers and things that are used in the hospital. And the fourth is the water and the waste that is generated in the hospital. That all needs to be decomposed, and the water needs to be recycled, and it needs to be purified. All of this requires a lot of energy. This energy consumption by the hospital also leads to a lot of energy emission by the hospital. In the operation theatres, in the process of the lighting of the hospital, the air conditioners, they generate a lot of energy which adds to the carbon mass in the atmosphere. So there is a network that the Public Health Foundation of India has in partnership with Healthcare Without Harm. This is called the Health Network, the Healthy Environment Leadership Platform. So this is addressed primarily in four ways. One is having green environment, which means that the hospital materials, the paint, the buildings that are done, they are done using climate-friendly materials. The second is around the use of energy for light. So there are lots of innovations that are being done now, which uses the natural flow of light within the hospital, reduces hugely the consumption of electrical energy, or the use of solar energy. The third thing that can be done is around how we use the air conditioner. Most importantly, the waste management that is there, that needs to be handled with huge care so that it reduces the emission of energy and adding to the carbonization in the environment.
To accelerate climate health action, we need to leverage innovations to make health systems and communities resilient to climate change. The PATH's Accelerator for Resilience in Climate Health initiative aims to improve public health outcomes in 56 Commonwealth countries. For example, in field testing solar-powered medical-grade refrigerators in Maharashtra, India, to ensure vaccine delivery during floods and cyclones, offsetting carbon footprints from traditional healthcare supply chains.
We have to adapt and mitigate. I think mitigation is going to be absolutely critical, and for that every sector needs to work on mitigating. Even we at our homes need to mitigate for climate change. But mitigation at the health center level is going to be absolutely critical. I mean, one of the things that we've recently sort of tested out is, and that's around heat, which is that how do we reduce the heat inside a health center? So it's very simple. It's a coating of paint which reduces the temperatures from 2 degrees up to maybe 5-6 degrees inside the building. So, can we actually roll that out in all our health centers across the country? That's being tested out. There are lots of things happening on mitigation also in terms of using solarization. So we have a solarized suitcase laboratory which can actually go across. Now it does two things. One is your access becomes better, and secondly you're not using energy to actually do all those tests. We have a vaccine carrier which is actually powered by solar. So that changes the game quite a bit. So many such technologies at the moment. The challenge with the whole climate and health piece is there's a lot of conversation. And for Path, we are focusing on how do we get technologies that can be rolled out immediately from a scale perspective. Because the impact will only come when you're able to scale it up. One or two is not going to have impact on the larger piece. So that's really where we're going, where we're saying, okay, look at technologies which can be rolled out quickly, which can have quick impact.
An adaptation solution can help pediatric patients breathe clean air, involves using affordable indoor air purifiers retrofitted onto ceiling fans, reducing PM 2.5 concentration by 50% and improving AQI from 350 to 60 within 2 hours. Energy for Health brings decentralized solar energy solutions with efficient medical and electrical equipment to 25,000 healthcare facilities. Selco Foundation, in partnership with the Ministry of Health and Family Welfare, Government of India, National Health Mission, and state health departments supported by the IKEA Foundation and health sector experts such as PHFI, is implementing this initiative to improve universal healthcare using solar energy while supporting India's climate adaptation and mitigation ambitions.
Welcome back. As part of the NDTV Detol Banega Swasth India campaign, we're exploring solutions to mitigate climate change. And collaborations play a key role in mitigation as well as adaptation.
Partnerships are crucial as emphasized by SDG 17. Along with the government, NGOs and corporates can play a key role. Partnerships are vital for implementing the United Nations Sustainable Development Goals.
Reckitt devised a 3C strategy. It's a campus, collaboration and curriculum. So we have created the climate resilient schools in the state of Uttarakhand. We started with the 1, now we have 4, and the year 2024 we are going to be there in around 10 schools in Uttarakhand. On the top of that, we have also announced the climate scholarships for the young kids. Second interesting and important thing is the curriculum. We created the curriculum on the climatic changes, impacts, based on our Honorable Prime Minister's mission life. So we have incorporated some of the best practices from there in our curriculum, so that there is an integrated curriculum which is available in the schools, and the young kids have the nudges so that they can actually do some impactful work on the climate. Third important topic is collaborations. And as we know, like civil society has a very, very important role, same as the role of the government. We're very proud to say, like over the years with NDTV, with Oho Hill Yatra, with the government of Uttarakhand, with the Honorable Governor and the Chief Minister of Uttarakhand, and the school teachers, principals and the extended communities, we are able to demonstrate the ray of hope, the ray of change in terms of the work what is happening on the climate. And I'm very sure this is going to go in the long way.
Just last year in 23 in September, there was a general comment number 26, and what it says is we should have children at the core of all the discussions or agreements or decisions in member countries which are happening around climate, because children are at the core of this crisis. They are suffering the most, so we should engage them in all the policy formulations, all the solutions, and we should also help them champion their own cause. Now, what are some of the specifics that we could do? Children, for example, can champion countries' focus on reducing emissions and being a net zero economy. and then children can then help the governments on certain specific health system solutions. So what kind of health system solutions, for example? Focus on the primary health care with a cleaner health system and a greener health system, which itself is emitting low. So for example, if you want to have health facilities that are solarized, that have their own emissions reduced, but at the same time, there is a focus on building capacity of healthcare workers and communities with more knowledge and skills to combat some of these environmental degradation and climate issues. Then we should also ensure that children are also engaged in some of these activities when we are planning for these activities. For example, we have a youth ambassador, and we from time to time as UNICEF, we encourage youth to come forward, champion the causes, and we also engage them as formal ambassadors.
I think technology plays a very crucial role in mitigating the climate change, because ultimately it is something that we are doing to mitigate what is happening through nature. Actually, we are trying to reverse what we have done to the climate through our industrialization. So we are trying to mitigate it or trying to solve the problem. So definitely technology is a main key stay there to solve those problems or mitigate its effect. Actually, health tech innovation, the most important challenge is to how to make it affordable and accessible. So there are many cutting edge technologies that are coming up now, say cell and gene therapy, for example, for cancer patients. But there are technologies now which have come up. Technologies are there which can actually cure it. For example, CAR T therapy, it can cure. But the problem is the cost of therapy is so high that you cannot afford it. However, we have to develop this indigenously to reduce the cost, because if you license the technology from outside, it will incur a lot of royalty sharing. Then if you have to use the raw materials to develop here, but raw materials are coming from outside, then it will again increase the cost. So if we can reduce this cost, if we can do, as our Honorable Prime Minister talks about Atmanirbhar Bharat. So unless we are Atmanirbhar in producing these raw materials within our country, so production linked incentive scheme is a very good incentive which our country is giving to our startups or even companies who can produce indigenously, and they will be incentivized. So cost of production is a very important thing that we have to think about, which we are actually taking care. The other challenge is the deep tech solutions. Deep tech solutions, for that we have to actually fund our research institutions more and more so that they come up with a deep tech technology, because most of our funding is going to the research labs and it's 0.6 to 7% of GDP, which is very less. In other countries around 3 to 4%, at least 2% of GDP. So that has to increase to actually generate more and more deep tech startups.
From decarbonization to mindful buying, from saying no to plastic to carpooling, each one of us can make a difference. Moving forward, innovations and technology will play a crucial role in addressing climate health needs. Collaborative efforts will also play a key role in bringing about impactful solutions. Thank you so much for watching this special show. Stay tuned on the NDTV Detol Banega Swasth India campaign for more insightful solutions. Together, we can build a healthier and sustainable future.